I've got 10 minutes, less than 10 minutes, to give my presentation, and I'm probably not actually going to give my presentation in full. The focus for me today was to actually launch our report about severe ME, but what I'd like to do first of all is to start off by defining what it is we're talking about in terms of today. I'm going to read you two case studies. Adam has what some people might call mild ME. As on the face of it, he's able to work. But this doesn't mean that ME has not had a huge impact on his life. The only way he can continue to work is to use one scheduled sick day each week to spend resting at home. In contravention of the Equality Act, his employers consider this to be a reasonable adjustment. It isn't, and he doesn't have the energy to fight. He must rest each day as soon as he gets home from work, otherwise he won't be well enough to prepare dinner. Adam is single and lives alone, so if he's not well enough to prepare dinner, he doesn't eat. He no longer plays hockey, goes snowboarding, goes on holiday or socialises with his good friends in other cities because he's too unwell to make the journey. His friends who live locally no longer see him because they don't understand why he isn't better already. Adam's family have begun to accept that he must pace if he is to manage his limited energy. But his mum got very upset when she dropped in on him and had to ask her to leave after an hour because he needed to rest. Adam has what is called mild ME. He is severely affected by that illness. Beth is has a much more severe form of ME. She spends 20 hours a day in bed, but no amount of sleep will relieve the exhaustion she feels. She cannot tolerate bright light or any sounds much above a whisper. She is only able to communicate in very short bursts. Her muscles and joints are very painful. Beth's parents care for her full time, having helped her to apply for personal independence payment. 8 months on, they're still waiting to hear if the application will be progressed. So Beth has what we are defining for the purpose of today, severe ME. There is a huge debate. We're not going to debate it today about the terminology, the labels, the language that is used to define ME, and it's a really important debate to have. But actually, for the purpose of today's event and for the purpose of our report, we're talking about people like Beth who will have a whole range of experiences. Beth's experience is not unique, but somebody else who has severe ME will have a different experience. I'm just going to move that out of the way. So the report that we're launching today is called My Life Stopped, and it's the voices of people who completed our Time to Deliver survey earlier on this year. Over 2,000 people completed that survey. 24%, I think, defined themselves as having severe ME. For the purpose of the report, the definition that we used, and it was a self-selecting definition that people completed the report. You are not able to do any or only minimal activities for yourself, and you are bed or housebound most of the time. And lots of people talked about the severe cognitive difficulties they had, the huge range of sensitivities they had, and the extreme frustration that they experienced in terms of not being able to engage with life as they had previously. So the report itself was completed by 2,081 people, and the diagram that you've got up there actually is quite representative in terms of the demographics of the UK. This gives you a bit of a breakdown in terms of the people that completed the survey. 22%, not 24%, define themselves as having severe ME. In terms of the report that we launched in May, our Time to Deliver report, these statistics are the impact that people told us about. And I think they're shocking. And it's so important that we have up-to-date evidence and voices from people who have this illness, because it helps us to go out and to talk to doctors, to talk to the public, to talk to politicians, to talk to policymakers. So whilst there wasn't much in there, most of the people in this room probably won't be surprised by the content of the report. It's so important to have that up-to-date information that we can then use when talking to others. I'm sorry, I'm very aware I'm rattling through this. So in terms of severe ME, These are the impacts. So those 22% of people, the data that you now see and the data that you saw in the film earlier on and the quotes that I'm about to share with you are all from people that identified themselves as having severe ME. And I think it's shocking that you think that 65% of people have been ill for more than 10 years. And I know there are people in this room that are caring for people that I've met that have been ill for an awful lot longer. It's shocking when you look at the amount of services or the lack of services, the amount of support or the lack of support, the amount of financial benefits, etc., or the lack of benefits that people with this illness have, and they've been ill for 10 years, 20 years, 30 years, 40 years, maybe even longer. And myself and my colleagues, the team and volunteers, actually manually input most of the data from the responses from this survey. It was heartbreaking. You know, a number of us shed tears at actually reading somebody's really scrawled writing. They had spent hours and hours and used valuable energy, tiny little bits of energy that they had to complete this survey. And it was, you know, it was just heartbreaking. There is nothing that I can say that can actually do those voices justice. These are some of the things that people told us. And actually most of us, you know, would think about being able to prepare and cook a meal as just something we do. It can even be a chore. And hearing from people that actually would like nothing better than being able to prepare themselves a meal. And hearing from somebody a few weeks ago that about a 27-year-old woman who actually hadn't eaten because there wasn't anybody there to prepare her a meal. That is simply not good enough. And today is about us trying to find just small, tangible ideas, solutions that we can put into practice to be able to try and alleviate just a tiny bit of the experience that people have to endure. So the question that we're looking at today is, how might targeted support and care be provided to those facing the complex challenges of the most severe form of ME? If it were easy, people would have done it years ago. There are no magic answers. We know that there are no evidence-based treatments for people with severe ME. Regardless of what we think about the research that has or hasn't been done, there are no evidence-based treatments at this point in time. There is no pharmaceutical cure, and we ain't going to change that today. You know, we're not unrealistic in terms of what we want to come away with by the end of today. What we do want to come away with by the end of today is some ideas that you've got, taking some time to try and capture those ideas, and we will, as a charity, work with others. There are other charities in the room today, there are researchers in the room today, there are clinicians in the room today, there are people affected by ME in a whole range of different ways in the room today, and we will do everything that we can to try and create some level of change. I don't know what that is, but we will certainly do our best to do that, and we will put our time and our resources to do that, because it simply isn't good enough. So in terms of the social, financial and emotional cost for people with severe ME, it is shocking that 60% of people had not had a social care assessment. How in 5 years? How can somebody that is so severely affected, or has a very severe form of the illness, that is in bed for 20 hours a day, not able to prepare meals, not able to do the things that some of us take for granted, how can they be left to rot, essentially? It is not acceptable, and it's not acceptable that social care are not working harder to meet the needs of people with severe ME. We know that budgets are constrained. We know there is not enough money to go around. We know that most people in health and social care are fantastic and do what they can, are as frustrated as we are. But actually, that has to change, because people are entitled to support when they need it. That's what we pay our taxes for in terms of the NHS. So we have to shout louder, and not just as a single charity, but actually as a collection of people, collection of charities, and try and create some change there. In terms of the isolation and loss, and I think this is when I told this story a couple of weeks ago in Brighton, but when I invite people around for dinner and we sit around the dinner table and we're having a laugh and we're enjoying each other's company, and people talk about my job and don't quite get their heads around what ME is and how it impacts on people. The statistic I often use just to start the conversation is about the emotional impact of being isolated and losing friendship and not seeing people and not being able to be near people. And the fact that 94% of people have stopped or reduced their social contact is phenomenal, and that is a statistics that makes people sit up because they can relate to that in some way. We're lucky to be sat around this dinner table tonight. 94% of people with this illness would not be able to be, or actually it would be at a huge cost if you've got a milder form of the illness itself. In terms of family and friends, we have explored quite a bit about the role of carers, and we know that there is a huge impact for carers, and particularly children and young people. And we know that in this country, if a young person is caring for somebody and they're classified or defined as a young carer, they're entitled to a social care assessment. We also know that that doesn't happen, and a number of the people that completed this survey talked about their children who were looking after them. And that's not acceptable. It's not acceptable across the board. It's okay to have a caring role in a family and to support somebody. But when you're talking about people who are so severely ill in the way that we've just heard from the testimonial, actually what impact does that have for children and young people? And we're starting to think about what support that we can put in place and information. How can we work with young carers, charities and support services to actually make sure that they know a bit about ME and that they can come to us if support is needed. It's not surprising that 93% of people with severe ME are not in any form of work, paid, unpaid, training or education. Some might say if you've got severe ME, then actually that figure should be 100%. I'm not going to debate that statistic. That's the statistic that came through from the report. But there is information out there that looks at the economic impact of lost earnings and people not working. We need to use those statistics better because they're shocking. And what's lost in terms of the finances within this country should be a statistic that makes politicians stand up and take note. So we want to, leading on from that, ask the question, how can appropriate information about self-management and self-care, bearing in mind what I've said earlier, that there are no evidence-based treatments for people with severe ME, what is it that we can give? And there are resources that we have shared in our Interaction magazine that were based on a book that was written by somebody who has severe ME that actually can be helpful for people. So how can we share that better? In terms of healthcare, some of these statistics were shared in the video, and it's really interesting to note what people want. Time and time again, we hear people talking about their experiences of going to see their GP. And I have said repeatedly, there are some amazing GPs out there. We've got one in the room who's standing for election today. I can't see him at the moment. Dr. Gregor Purdy, who's the only GP lead in Scotland, and him and a nurse are the only people dedicated solely in terms of ME in Scotland. And Gregor's actually just retired and is taking on a slightly different role within the NHS. But it's not that hard. GPs have a huge range of things that they have to cover, a huge range of illnesses. They can't be expected to be experts. They're general physicians. But actually, for somebody to be sat there and say, I don't do your illness, I don't believe in ME, or actually I don't know enough about it, is, hi Gregor, see you now, is simply not good enough. So how can we work towards personalised healthcare that takes into account the specific needs and complex symptom presentation of those with the most severe form of ME? We have redesignated a table. There was such demand for people to sit on the table discussing healthcare. Table 5 is now an NHS table. So if you didn't get your first choice and you want to move to table 5 in a minute, please feel free to do so. And then in terms of welfare benefits, we know that the welfare benefit system is not good enough for disabled people more generally, not just people with ME. And we are working with groups like the Disability Benefits Consortium to challenge some of that. So one of the questions today is how can those most severely affected by ME, including carers, be supported to access the welfare benefits they are entitled to? And it's an entitlement. It's a right because of the system we have. It shouldn't be something that you are treated as though you are guilty until you can prove that you're deserving. This is just a summary of the useful resources. They are all in this report, and the report is a qualitative report. It's got some statistics, but they are the voices from people who completed our survey. And there will be more reports as we start to analyse some of the other data and statistics and voices further. We will have more reports that come from the overall survey. And this is where you can find out a bit more information in terms of action for ME.